Hi, this is Roger Green, host of the Surfing the NASH Tsunami podcast. This weekend, we are offering 4 conversations from Season 3, Episode 8, our discussion of the Innovations in NAFLD Care 2022 initiative. In this final conversation, panel members consider some innovative ideas for the meeting agenda and describe activities and efforts they would like to see happen as a result of this meeting's lessons and successes. The recent Innovations in NAFLD Care webinar and upcoming hybrid conference in May constitute one of the major initiatives to shift the focus for fatty liver disease awareness and treatment beyond the hepatology community to a broader, more diverse set of medical specialties and patient advocacy organizations. So, sit back, listen, enjoy, learn. When you're done, join the dialogue on our LinkedIn and Facebook discussion groups. Jeff Yorn, what benefits will people who attend the May event do you expect they will get out of this, and what is your best pitch to them about why they want to be there as compared to why you want them?
Jeffrey Lazarus.
That's a good question. What are people going to get out of attending a meeting on innovations in NAFLD Care? They're going to get a multidisciplinary approach. They're going to get the top experts in the world delivering state-of-art lectures from different perspectives. They're going to hear about developments in non-invasive tests, but also developments in weight management. They're going to get a chance to hear patient perspectives, and they're also going to get a chance to participate. We'll have some polling, we'll have questions, we'll have different ways to engage in addition to the questions and answers that they'll be able to have for these sessions. It's going to be a fun meeting, so it won't be death by PowerPoint. We're going to try and engage with each other. We're going to try and engage with the audience.
Jörn Schattenberg.
Oh, and just to add to that, this is not just going to be another NAFLD meeting. It's going to be the place where we hope to engage everybody and really move all these innovations that are coming out of the specialty meetings to a broader audience and scale to get everybody involved and have, in the end, patients benefit from all that progress that's been made in hepatology.
So, Louise, Stephen, what would you like to ask these guys, or what comments do you have about the program based on what we've been talking about for the last 45 minutes?
Louise Campbell.
I'm looking forward to seeing whether or not there's any coordination of the nursing care. And given that nurses make up the majority of the workforce, we know that adding nurses into pathways, diabetes are doing it quite nicely. There's some more evidence coming out of there about adding nurses or allied health really improves the outcomes. So I'm excited to hear what you guys are going to say on that perspective, and it'll lead to what I will be talking with some of the nurses next week.
Well, we look forward to hearing what you're going to be discussing next week, because hopefully that's going to feed into our program. And I don't think it's going to necessarily be
cheating.
Well, I don't think it's going to be Jörn and I necessarily speaking about the nurses. It's going to be you or someone you suggest.
The thought I had was we've been talking about how we're not going to get to meet Louise for the first time until EASL. And the immediate thought I had as I listened to her was, no, we're all going out to dinner in Barcelona in May.
You're all very welcome. I'm cooking.
Assuming we can get there. Stephen, do you have a question? If not, I'm going to ask Louise to take a couple of minutes and talk about what next week's episode is going to be, because it's going to be a little different.
Stephen Harrison.
Maybe just a thought. If I were designing this conference, one of the things I would want to have is a fireside chat or a roundtable discussion with a multidisciplinary group where you could ask the hard questions. And that would include patients. So you would have patient representative, endocrine, obesity management specialist, primary care, family practice, maybe even grab a podiatrist. Believe it or not, podiatrists see a tremendous amount of fatty liver disease because they manage the diabetic foot ulcers and the complications that go with it, as well as they manage foot fungus, toenail fungus, and they have to prescribe Lamisil. And before they do that, they have to check liver chemistry tests. And they often find them quite elevated and don't know what to do with the patients. Having said that, I would have a panel of 5 or 6, 7, 8 different specialists and patients. And I would pose the hard questions, the questions that we talk about on this podcast, the questions that are brought up in public forum, and just have a dialogue about what the challenges, the hurdles for each, and they may be different for each one of them. But collectively, you can begin to craft the narrative on what needs to be done to leave a big fat dent on this planet in the name of fatty liver.
Thanks, Stephen. I think that's great. And having seen how effective fireside chats can be, where you Definitely. I totally agree with you on that one. Let's let Louise talk for a couple of minutes about next week, and then I'll go back to Jorn and Jeff for a closing comment, and then we'll check out. Louise, go ahead. What are we doing next week? What are you doing next week? I'm not going to be there.
Well, to be fair, what we're doing, or what we're hoping to do, is cover some of the Lancet Commission. It was prominent in the Lancet Commission that they talked about the RCN competency document as being the only one in the world to look at the standards and quality of care that we as nurses should be given to liver patients. Now, what we want to discuss, we've got Michelle Clayton, who's one of the authors of the original and follow-up RCN guidelines, to look at the benefits and the strengths and weaknesses of those. What we want to do is say that these can be utilised around the world to enhance your care of liver patients and adapted. And we want to look at how that can be done. We want to look at the discrimination in healthcare by not having anybody who's a liver specialist from either a hepatology or gastro perspective in a hospital or particularly nursing areas. It is very difficult for a doctor to look after a patient who's encephalopathic if the nurses on the ward aren't trained to recognise encephalopathy or ascites. So by not having any strength in any area, particularly we use the UK as a setting, but we're looking at how we can use these to support that and to reduce the impact. We've got Dr. Catherine Jack, we've got Patricia Kunzler from Switzerland, and we've got Pam O'Donoghue, who's one of the leading cancer nurse specialists in this, nurse consultants in this country, talking about cirrhosis and the management of different tumours. This follows on from what Scott Friedman and Donna Cryer were talking about last week, in that different tumours in the liver require different therapies and how we get these patients through. So what we hope people walk away with is one of your underutilized colleagues are your nursing team. They are your strength if you use them as a strength, because they can empower your patients. And I think from a clinical trial perspective, a 20 to 30 minute conversation that a nurse specialist and advanced practitioner can have with a patient is probably very informative to get them into clinical trials, instead of the 5 or 10 minute that a doctor has to do everything. There's a better understanding of informed consent. There's a better understanding of your patient portfolio. So how we can utilise the strengths of nursing colleagues around the world to impact clinical trials in NAFLD and NASH, as well as the care of the patient. So those are the sort of things we would like to be bringing the science, bringing the academic side of the nursing processes, and how we can adapt those throughout the different countries that listen to this podcast, whether we can twin, how we can help support, particularly when we look at care pathways that Jeff and Jorn and everybody are talking about. How do we mobilise the strength of nursing throughout the world? Because if every nurse found just 5 people with fatty liver disease, and they meet them every day, we would actually turn around this tsunami. But by looking in those basic questions, the power is there. We just need to find a way to utilise it, to get that inertia, get that going. So hopefully we'll give some stimulating discussions and some thinking, and let people take away a lot of thoughts. Hepatology nurses are an asset, and they can save money, but they save patient time, but they allow our medical colleagues to really enhance their work. So I hope that's what we're going to be discussing.
It should be a fascinating session.
I was going to say, I think I'm intimidated to be a part of next week's podcast.
I'll recommend it to my entire team.
Good, and that's what we want. We want nurses listening to SurfingNASH. SurfingNASH is some of the best technology, the best innovations, the best research in the world. We should be listening. I would say that to all my nursing colleagues, not just medical colleagues, just not science colleagues, but allied health colleagues. We need to know this is coming, because we need to plan how these pathways are going in 5 and 6 years' times if we get medication through, or even now how we can maximise lifestyle. So, yeah.
Louise, that was amazingly compelling. I'm thinking you need to write a pitch that Jeff can use and Jorn can use as well when talking to some of those audiences, because you boiled it down really neatly and really cleanly. You should be able to sell people who go to Barcelona and everything else.
Well, you said I was a host, so I had to. Normally I'm not the host. I don't have to drill it down.
So you just taught me a couple of things. Actually, Jeff, you're on closing thoughts.
Thank you for the opportunity to say a few words about our webinar, the coming meeting. I say our in the broad sense. This is a multidisciplinary event with a lot of people involved. I think it's been a long time coming. It'll be complementary to the other liver health and NAFLD and NASH meetings that are out there. We just want it to be an open forum where people can share and learn. We want to emphasize even implementation and operational issues, in addition to some of the state-of-the-art talks that'll really be the scene setters to get those discussions going. It's 6 sessions split over a Friday and a Saturday in Barcelona in May, so it's not the worst setting to be in, but we also respect that some people won't be able to travel, so we'll have it as a hybrid meeting. We hope that we're going to try and have all the speakers travel so that those who do come can engage with them. But we're excited about this because, just like Louise put out there, we need to engage not just the nurses and the primary care doctors and the endos, but so many different specialties and the patient organizations themselves, so we can start to slow down the force of the tsunami.
Anything else to add on top of those two rather remarkable sets of comments?
No, I think they hit the ball out of the park, as you say in the US. I'd be happy to have you guys there and engage and meet, and really looking forward to that. And we're just finalizing the program, so be on the watch out for that.
I think this would be another great meeting to host a podcast from.
We are a media partner, and that is part of the plan, is to do that. And actually, I think that's exactly right. Of course, Stephen, that means you're going to have to go.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please send an email to questions@surfingnash.com. Next week, Surfing the NASH Tsunami will be back with Louise Campbell hosting a group of nurses and affiliated professionals talking about the practical challenges of fatty liver disease. I'll be back in 2 weeks with a discussion stemming from one of the major initiatives coming out of NASH-TAG, the NAIL NIT initiative. Until then, stay safe, surf on, and we'll see you soon on podcast. Bye-bye now.